Good day, I'm Dr. Lebete. I'm sitting today at the Vets Dental School, and I got so impressed as I got here today. I was made aware of the fact that today is the world's Head and Neck Cancer Awareness Day. And I got shocked to learn that the head and neck cancers combined are more than those of the breast cancer, and affects more people and results in more mortality than the breast cancer. Now, this Awareness Day has suddenly illuminated to me how important oral health care is. And this is run by the World's Head and Neck Oncology Society together with are you the deputy president thereof? The deputy president thereof, who's placed at Vets. It's saying to us that the totality of health is very important, and we actually would like to encourage the Vets Oral Health School to continue working hard, increasing the awareness, but at the same time, it would be much better if they up the research thereof and make it good for all of us. Now, being an academic institution, they have a further responsibility of not only discerning, teaching and researching, but at the end of this day, or at the end of every day, this must flow into the better health for all of our citizens. Congratulations, and continue the hard work. I thank you. You know, in terms of early detection, the importance of early detection, the sister to my mom, who's now 90 plus, 2001, she was breast examining and found a small lump, and she shouted, and she was referred. She came here to Charlotte. She was assessed. She ended up with mastectomy, went through chemotherapy, went through radiotherapy, and at some stage we thought she was going. It's more than a decade now. Really? She's still walking around. I mean, she was in her 80s when she was diagnosed. Now, that tells you about the need and the importance of early detection.
The thing is, and you made the point very well, that this information needs to be going out to our rural clinics, because by the time the patients get to us, the tumours are often inoperable. And I think the other important thing about head and neck cancer is that it affects all your 5 senses. You know, you can have cancer other way somewhere else in the mouth, but taste, smell, hearing, all of the 5 senses are affected. So it's that cancer which carries the greatest morbidity as a result. So even if you survive it, you're surviving a life that is compromised.
Exactly, because
my name is Dr. Maseche. I'm the head of Nose and Throat Department at Charlotte Maxeke Johannesburg Hospital and the University of the Witwatersrand. So I'm responsible for both postgraduate and undergraduate training of ENT doctors. It's a good initiative that we're having today in screening for head and neck tumors, which a lot of our patients, as I said, they present quite late, and it's not that it's their fault. Sometimes, yes, they do present late because the tumors are not painful. If something is not paining, there's no need to go to the doctor. And I always make an example of this patient that I did way back when I was training. Presented early, 20 years ago, with a cancer of the larynx, picked up early, the patient is still alive today. So early detection is very important.
That's the main drive for now.
Exactly.
What do you think the best way is for the likes of us to be able to get that news to the primary health care and the traditional?
With the foundation like this, I think you need to reach a wider population, a wider audience, especially with primary health caregivers, especially with the nurses. I mean, ideally, in a situation like ours with limited resources, you want everything to be at the primary care level and to be escalated to secondary and tertiary care. So at primary care level, I think maybe in a form of workshops or posters that we put up in local clinics, so that the people that primarily see the patients can make the correct diagnosis. And then beyond the primary healthcare setting, of course, the general practitioners are very important. That's why the CPD, the CPD meetings that people have, I think in every CPD meeting we should include a head and neck slot.
Yeah.
Because that's a major area where these tumors, as I say, once picked up early, patients can be cured.
Make it so much easier.
Yeah. So at the primary care level and at the general practitioners level, and even at the casualty level, when these patients present with a lesion in the oral cavity, the doctor has to make a differentiation between a straightforward viral ulcer or a dental problem to a malignant lesion. So those as well, doctors need to be educated on that.
Hi, my name is Dr. Brunel. I'm one of the ENT head and neck surgeons here at Charlotte Macleay Johannesburg Academic Hospital. I've been qualified for 2 years, and I've also done an outreach fellowship in Edmonton, Canada on head and neck surgery. And today is International Head and Neck Cancer Awareness Day, the 27th of July. We celebrate this day every year, and the idea is that we provide awareness to those of you out there who would like to know more about head and neck cancers, and we would like to encourage you to come through and see us here at Joburg Gen in our ENT clinic or here at the dental school if you have any concerns or you'd like more information about any head and neck cancer. The point of what we do here is to spread the word, to try and get the word out to very, very basic levels. If you have any ulcers in your mouth that aren't healing, if you've got any lesions on your face or your lips that you're concerned might be a cancer, if you have any unusual lumps or bumps that you've noticed in your neck, if you have any pain on swallowing, or if you've lost a significant amount of weight, if you smoke or drink alcohol excessively, and you're concerned that you might be developing a cancer, please come through and see us.
Hi, I'm Miritin Chokwane. I'm a prosthodontist at the School of Oral Health Sciences and Wits University. And in our department, we work hand in hand with oncology and ENT to treat and rehabilitate head and neck cancer patients. Today being the third World Head and Neck Cancer Awareness Day, we are going through a screening process, and in this process we are hoping to identify early signs and early symptoms that may we're trying to identify people who are at risk of developing head and neck cancers. We look out for lifestyle habits, smoking being one of them, alcohol consumption, and one of the things that is not often spoken about is diet, what we consume.
It's very nice to be able to have some of my surgical colleagues chatting about head and neck cancer and their involvement in the diagnosis and management, and in particular the rehabilitation of our patients back into society. We're all involved with bigger groups like the Face Value Foundation for one, our own multidisciplinary head and neck units both in the school and outside. Some of our international societies, like the International Society for Maxillofacial Rehabilitation, which I believe Lisa has already had a fellowship opportunity in Canada.
Yes.
and our own South African Head and Neck Society, and these are all affiliated to the International Federation of Head and Neck Societies, of which today is Head and Neck Cancer Day for the world. I'm very interested to know how my surgical colleagues feel about early detection, maybe a little bit on what the patients out there that are watching this must look out for. What are the signs and symptoms that say, I need to go and see a doctor? What do you feel?
Thanks, Prof. From my side as an ENT surgeon or the head and neck surgeon, our job is to try and cure head and neck cancers and hopefully promote awareness. We've discovered that unfortunately head and neck cancer is very prevalent, but it is something that we're all very passionate about. And if we can detect the cancers early, patients can have a much better outcome, both from an oncological perspective as well as a cosmetic perspective. So if you're concerned about any ulcers in the mouth that aren't healing, any lesions on your lips or on your skin that aren't healing, that are getting bigger, any problems with swallowing, any pain on swallowing, loss of weight, please come through and see us. We're very passionate about our job here. We're willing to help you. We run very efficient clinics in a multidisciplinary fashion, and we'd like to get you into the system as soon as possible so that we can get on top of the disease that we face today.
So how does ENT and maxillofacial interface in this process?
Well, we work very close together. As you know, the head and neck is not one field. Many fields work within all these multiple structures that we deal with. So the maxillofacial team, I know Dr. Curry will elaborate.
Basically, is the big difference from you guys is that you're sitting there from a curative point of view, and as a head and neck dental medical team, we're there from a rehabilitative point of view. And it's very difficult to separate those things. I mean, in some units around the world, you and Mbali are one person.
Yeah.
I'm never sure whether that's a good thing or a bad thing. How do you guys feel about that?
No, it's all about sharing. I mean, the face, like she said, and the neck is such a big area. So the one will have the expertise more than the other. But cancers present in the mouth, and the first people to see that will be the maxillofacial surgeons, because now they'll be the one that looks into the mouth of the patient, and they see that there's this sinister looking tumor or tissue, and they'll do the biopsy, and diagnose the patient, and if the cancer is spread and it's outside of our scope and field, then we'll send it to the relevant people, which most of the time as the ENTs who have the expertise to resect the tumor. Sometimes we do resect the tumor ourselves, but they also have the capabilities and expertise to do the neck dissection for the patient, so that it's curative treatment that they have. But we also help in the reconstructive phase of the patient, because if the jaws are involved and there's soft tissue loss, then we include the plastics to come and do the soft tissue, and we'll include them to come and do the bone. Sometimes we can harvest our own bone and put in a reconstruction plate and reconstruct the patient. So it's a team thing. It's not effort. Then there'll be also the prosthetic guys that will rehabilitate the patient and give.
Based on the foundation you've given. I think the thing for me that's so stressful is that we don't want to make the treatment of the disease more grievous than the disease itself. And that decision process, and I'll ask Lisa here, when and how do you decide that it's too late, or this patient we can treat, or there's this whole continuum, because the smaller the lesion and the earlier we detect it, the better the outcomes, as you said. But there comes a point that this may not be treatable, and how do we move forward from that point of view?
Thanks, Prof. Unfortunately, in our setting at the moment, we do see a lot of cancers that are end stage and are inoperable. And it does make it, or even borderline operable, it does make it very difficult to decide patient management from there on out. The small lesions are easy, we know how to treat those quickly and efficiently. It's when patients present late, the challenges come in.
Highlights the importance of early detection.
Exactly. And I think that the best way that we can approach these situations is on an individual basis. And I think we're very good with keeping the patient informed, with getting them involved in the decision making. Because there are various different routes you can go down with end-stage cancer treatment-wise. And I think it's very much an individual situation, or individual consideration that we need to make. But none of these decisions are easy, and that's definitely why we need each other as a team for the support, to all give advice, and to try and get on top of this disease process as much as possible.
Can I just add on that?
Of course.
Even if the patient is not operable, you can't operate or resect the tumor, but there's some form of other treatment that you can offer the patient. It's not like you're going to say, oh, okay, fine, now you're end stage, we're not going to do anything for you. You still try by all means. You'll exhaust all avenues. You'll try radiotherapy, you'll try chemotherapy, but you will do something for the patient.
As long as you don't make the patient's life worse than it already is.
Yes.
But that's the important part of the palliation process. And unfortunately, those practitioners are in short supply. People who really understand how to manage patients in end-of-life care, who are equally useful during the process of symptom management, and it would highlight the need to be able to find and train those kind of personnel to keep the patients as comfortable as possible in that phase.
That's right, Prof. And I think also that people need to be aware that cancer, any form of cancer, doesn't just affect the individual, but the support structure of that person as well. And we find that with head and neck cancers, it can be very tough to be the caregiver of such a patient. Often they cannot swallow, they cannot breathe appropriately on their own, and that care of these patients can be very, very difficult and very taxing. And I think that that's another thing to bring up, that if you know of somebody who you suspect might be developing a head and neck cancer, encourage them to come in, because this disease process doesn't just affect the individual, it affects the entire network of that family.
I think the point that needs to be made here also is that we're treating the area where all 5 senses are present. Those are the senses that give you a quality of life, your taste, smell, feel, etc.
And it's disfiguring as well.
And it's disfiguring. So it's not like the other cancers that one you can hide it and one can still interface with your family, etc. So that's what makes it the most morbid of the diseases. And it just gives us a greater responsibility to manage those areas. It just makes it tough.